Good morning, everyone. It gives me great pleasure to welcome you all to today's online health talk session. On the occasion of World Autism Day, we have gathered to create awareness and deepen our understanding of autism. I am honored to introduce today's speaker, Dr. Jenie, who will be delivering this insightful talk. She is currently working as Assistant Professor and Medical Officer in GASSINYS, heading the Department of Pathology. And with over 7 years of experience in her field, she brings with her a wealth of knowledge and clinical expertise. We are truly privileged to have her with us today to share her valuable insights on this important topic. Over to you, ma'am.
Thank you. Good morning to everyone joining us online. Respected principal, esteemed member of the management, my dear colleagues, and all the viewers present here today. At the outset, I would like to express my heartfelt gratitude to our respected principal and the management for giving me this wonderful opportunity to speak on this live platform on the occasion of World Autism Awareness Day. Even though we are connected virtually, I feel truly honored to be able to reach each one of you and share a few important thoughts on a topic that deeply reflects humanity, acceptance, and inclusion. Today is not just about awareness, it is about understanding, empathy, and creating a society where individuals is valued and respected for those they are. Thank you for being a part of this session. So here I'm going to talk about the Autism Day. It is an evidence-based overview of autism spectrum disorder, emphasizing supportive integrative management through naturopathy and yoga and the fundamental dignity of neurodivergent individuals. So why is more concern about World Autism Awareness Day? So the theme of this year is autism and humanity. Every life has value. So autism spectrum disorder is a lifelong condition that affects the person communicates. So why this awareness program is conducting? So autism is increasingly recognized worldwide. So we want to accept a person and we want to make their fundamental rights and inclusion of all the autistic people. And also to have an awareness to acceptance, appreciation, and full participation. So we have to strengthen them with their own creativity, resilience, and innovation across society. And also we have to promote the autism kid in their health, their quality education, their decent work, and also to reduce inequalities. So, what is autism? So, autism spectrum disorder (ASD). It is a complex neurodevelopmental condition. So, it is a characteristic by persistent difference in social communication. They are very much different from the social communication and interaction. Alongside, they have a restricted or a repetitive patterns of behavior, interest, and sensory differences. So they are completely different from a normal person. So it reflects a wide, diverse variation in individual strength. Daily support. We need to give a daily support, and also we need to understand their cognitive abilities and also their language proficiency. So it emerges in early childhood. So it is a lifelong neurotype, and it is not caused by a parenting practices or any social environment. So autism actually, it is not an illness or something that need to be cured. So it is a different way of thinking and processing information. So they will have a continuous, they will have communicate differently. So they some speak less, while other may be very verbal. They also prefer routines and find comfort in predictability, and will have a strong interest in like a specific topic, and experiences they will experience the senses like sound, light, touch, and more intensely or differently. This is how the autism kid looks. What could be seen in autism kid? So they will have non-verbal communication and play skills. They will also have the restricted interest. They will have a preference in routines, and yeah, as I said, like they have a preference in routines and repetitive movements. Some people will have some hyper, and some people will go for hypo reactivity. So they also have a highest like a heightened sensitivity to sound, lights, and also they some of the autism kid will also have like co-occurring conditions like they have anxiety disorder and depression like ADHD, epilepsy. So they will have a persistent sleep disorders and GI. Usually, a person coming with an autism, like autism kids, usually have the GI issues. So, as a naturopathy and yogic practitioners, we also improve their gut mobility so that the early child autism symptoms and signs will be also we can be understood clarity in clarity way, and also we can able to treat them. So it is a it is a global development delay, so highly variable across the spectrum. So in an epidemiology of an autism, like one in 127 in 127 kids, one will be in autism. So from the global burden of disease estimated in the year of 2021, so they have estimated so 127 in 127 kids, one will be in autism. So refers how to often a condition occurs in different group of people and why. In the case of autism spectrum disorder, so research over the past decades has helped us to better understand in global patterns. So autism is increasingly recognized worldwide. So recent estimates, not in 2021, in the recent estimates suggest that about 1 in 100 children globally are diagnosed with autism. So in some countries, such as United States, estimated higher, around 1 in 36 children, partly due to better awareness and diagnostic system. And in the gender differences, coming to the gender differences, autism is more commonly diagnosed in boys than girls, with a ratio of about 3 to 4 males for every one female. And however, autism in girls is often underdiagnosed because symptoms may appear differently. And the age of diagnosis of the autism, the signs of autism usually appears in early childhood and before the age of 3. Many children are diagnosed between 2 and 5 years of age. So although some individuals are identified later in life, and geographic variation like autism occurs in all countries and cultures. So reported rates vary between regions due to difference in awareness, availability of healthcare services, and diagnostic criteria and reporting systems. So number of diagnostic cases has increased over the years. So this rise is mainly due to this awareness, to improve awareness, broader diagnostic definitions, and better screening and support. So it does not necessarily mean autism itself is becoming more common. So the risk factors like parental and maternal health, like advanced parental age, like in the maternal and paternal and maternal conditions such as diabetes and obesity, and also prematurity and low birth weight and severe perinatal or birth complications. So in that cases, and also use of certain medications during pregnancy, including valproate and carbamazepine, and environmental factors like the exposure to the environmental hazards such as air pollution or heavy metals. So association does not equal causation. These factors often interact with the genetic vulnerabilities. So in that way, we have come with the risk factors like medications and age and also the environmental hazards. Coming to the cause and pathophysiology of the autism, many parents worry about the cause, but it is important to understand that autism is not caused by poor parenting. It is a combination of genetic and environmental factors. Clearing myth is an important step in including a spectrum stigma. So, what could be the symptoms? Like parents are usually the first to notice that something is different, like others to other kids. They will have a slow response. They will not have an eye contact. They will be more vulnerable than the other kids. So these are the first starting fundamental signs and symptoms the parent will be able to understand from the kid. Uh, so yeah, early signs may subtle, but early action make a big differences. So so the environmental factors like pathophysiology. So here they have coming with so many scientific approach on the autism kids. They have a connection between the gut brain axis and immune system. So in that way, our naturopathy and yogic practices will help them. So here it is a myth that vaccination causes the autism. So vaccination does not cause autism. So extensive global evidence robustly refutes any link between autism and vaccine, so including MMR, aluminum. So all these vaccines will not cause us the autism. That is a myth. So how could we assess the assess and early identification is more important. So routine monitoring milestones at all standard well-child pediatric visits, and also we have a specific screening in autism spectrum disorder, which is recommended in the between the month of 18 and 24 months. So they have a specific assessment to check the kid is an autism or not. And by multidisciplinary assessment using standard DSM-5 criteria for accurate diagnosis, they will have an evaluation like the assessment, the language, the cognition, adaptive skills, hearing, and vision. And also they have the family-centered approach, delivering culturally competent care and ensuring timely referrals for early support. So current management for the autism kids, although autism has no cure, it can be effectively managed. Therapies aim to improve communication, behavior, and daily functioning. So there we are having a behavioral and communication skills to applied behavior analysis to encourage desired behaviors and build skills. And also so this current management will help to give the proper support. The many children lead independent and fulfilled lives. And also we are having an occupational educational management like to improve daily living skills and sensory integration. And also we are having early start Denver models And also we are having a parent mediated interventions like training caregivers to support child development. So coming to the integrative management, so first thing, as a medical management, as autism kit, recent researchers have come with the conclusion that they will have the connection between the gut brain axis and the immune system. So the autism kid usually they will have the gut issues. So that's a medical management. We will be more concentrated on the physical health. So the physical health, like the kid will have a epilepsy attack due to a poor sleep. So the sleep disturbance, GA issues, epilepsy, all these things as a physical health, the management will be taken place in the yoga and naturopathy integration. And also we will be concentrating on the mental health, like identifying and treating like the kid will have an ADHD issues. So in order to that, so we will also have the management in association conditions like anxiety and depression. And also in autism kid, they are also preferring the management of giving a pharmacotherapy, like to in order to reduce a severe symptoms. So certain autism kids will have a high amount of anxiety, and also some people will have a hyperactive. In order to reduce that, the management also prefer in giving a pharmacotherapy. And also we are having a family and lifespan support, like providing essential family education, psychosocial support, and access to respite care. So implementation of individual education plans and promotion of community integration. And also we are having a proactive preparation for adult services, independent living, and meaningful employment support. So all these an autism kid will have from the family side and also from the medical management. So apart from this, what the naturopathy and the yoga plays a role in autism. So as a naturopath, as a practitioner, we used to improve their physical health. So the kid will have the sleep disturbances. So to improve that, we go for optimizing their sleep hygiene. Melatonin can assist with the pediatric autism spectrum disorder sleep disturbances when implemented under clinical guidance. And also we used to focus on their balanced diet, and we also come with to concern about their deficiency of vitamins and minerals. So we also prefer to give iron and supplements, vitamin D and vitamin B12, as the kid will have gut issues. So in order to that, to get the good microbiota and also to improve their B12 secretions, all these things we will be more concentrated. Like as a naturopathy system, we will more concentrate on their gut issues. And also supplements like probiotics, yeah, as I said, like omega-3 have mixed with limited evidence. And also have a consult physician before starting interventions. So we used to avoid the unproven detox causes, chelation therapy. And also we have a approaches severely strictly on complementary system support and must never replace standards. So as a naturopath emphasizes treating a person as a whole, not just the condition. A healthy diet and natural lifestyle play a crucial role in brain development. Small lifestyle changes can bring meaningful improvement over time. So, as a naturopath, we heals naturally and support gently. So, we'll on focus on the holistic care, not just symptom. So, our aim to improve a body-mind balance. So, the autism kid will have an ADHD issues. Some people will have a hypoactive. So in order to that mind body balance improvement of that, we will be focusing on. So how we will be focused on that cases, like how the mind and body will be balanced. So how we will be managing their GIT issues. So by giving a natural diet and routine lifestyle, toxins free living, all these educations will be become a part of a naturopath, which will be helping them from reducing from their symptoms. So nature heals when we support the body. So small natural changes being which will bring a lifelong impact. So we'll also have the food which can influence the mood. So balanced, simple, and natural diet, like which will be our we also prefer and we also give an advice to the parents not to give the processed food, excess sugar, and with the proper support will be fulfilling their lives. And also we have support the parents, and also we give an education not to give an artificial additives, and also we encourages the parents to give fresh fruits and vegetables, giving more hydration, regular sleep. So these all things will be add on giving as a naturopath to the autism kid handling parents. And the second thing, as a natural therapy, we prefer to give a calm the body and calm the mind. So in order to that, we are preferring the autism kid to have a relaxation with the help of hydrotherapy treatments. We also give sun exposure to improve their vitamin D support, touch therapies, so which will give the calming effect to the kid, and also a routine based lifestyle. So some therapies powerful calming effects, and nature provides gentle healing. And also as a yoga perspective, so the yoga is a supportive intervention also. So we used to balance body, mind, and emotions through the yoga. So in order to that, we also concentrate on the autism kid to improve their concentration, emotional stability, body awareness, which will help them, and also that helps to reduce their anxiety and hyperactivity. And also to ask the kid to have a simple pranayama. So we'll give the simple pranayama, and also which helps to like, and also we prefer yoga nidra, so which helps to reduce stress, to improve the focus on a particular conditions what they are having, and also we improve their mental health, like emotional control can be better. Make better, we also gives yoga nidra, and also we prefer the kid to have a like stretching poses, balance poses, and also like um, individual needs, what the individual actually needs all. So based on that, with a clear cut, we prefer the asanas like tadasana, kati chakrasana. So all these asanas will give the balances in an emotional way, and also by physically like hyperactive kids will be reducing their signs and symptoms from that. And also we prefer the kid to have vrikshasana, like tree pose, so which helps to improve their balances, so develops concentration and builds patience. So and marjari asana, like a cat cow pose, and also we go with gentle breathing and also deep breathing, so which helps them to calm their mind, to reduce their to relax from their anxiety, and to improve their emotional controls. So even a relaxation also a healing. So we prefer the autism kid to make all the asanas to practices, and also we prefer the autism kid to improve their health through pranayama also. So usually the autism kids will not stay a long time to practice the yoga, to practice the naturopathy treatments. So we make a kid to like good rapport first, and we start with like 10 minutes and 15 minutes of integration, and then we'll be improving their timings with the naturopathy and yogic practices. So so here I would like to give a small story. Like there is a 5 year boy. When he went to school, he was not like another children. So he didn't speak much. He didn't easily make friends, and sometimes teachers, um, even a teachers also have the thought that he's a slow learner. But one day, his mother noticed something different. He may not have spoken much, but he saw a world in a unique way. The kid saw a world in a unique way. So he paid attention to the smallest details like the colors, patterns, sounds. So he had a world of his own, rich and meaningful. So when they consulted the doctor, he have diagnosed it with autism spectrum disorder. At first, the family felt fear and confusion, and they wondered what will happen next. But what happened actually is, but slowly they chose acceptance over fear. They started therapy, introduced routine yoga, and gave him patience and love. And today, do you know what he has become? He's an artist. So, what he could not express is in words, he expresses through his drawings. He may not speak much, but he communicates in his beautiful world in a beautiful way by drawing. So, the story teaches something very important. Children with autism may be silent, but their world is not actually empty. It is full of thoughts, feelings, and possibilities. Uh, they do not need to change to fit into our world. We need to learn to understand this, because every child deserves to be seen, every child deserves to be valued, and truly every life has value. So, as a theme, also, it is said that autism kids, if we should not, in the world, we should not separate them as an autism kid. So, in order to that, this awareness is more important. So as a conclusion, I would like to say every life has value. So as an autism theme, autism and humanity, every life has value. So dignity, rights, and inclusion of autistic individuals are not negotiable. So early individual care is most important. So all these diagnostic criteria is most important. Like multidisciplinary approaches significantly improve long-term outcomes. So early detection can be cured early, so that will help them. So as a yoga and naturopath practitioner, we improve their sleep, and also yoga serves as helpful adjuncts with the clinical oversight. So we must invest in support system across the entire lifespan for autistic people and their family. So today on World Autism Awareness Day, let us remember inclusion is not an act of charity; it is a responsibility. So, a child with autism does not need a sympathy but understanding, not isolation but acceptance. If each of us takes one small step to listen, to support, to include, we can create a society where differences are not judged but celebrated. Because humanity is not about being the same, it is about embracing differences. Thank you once again. Thank you all. Thank you for being a patient to listen this health talk on World Autism Day. Thank you.
Thank you, Dr. Jenny. On behalf of viewers, and the management would like to extend my heartfelt thanks to Dr. Jenny for her wonderful and insightful talk on autism. Your session was truly enlightening, and your clear explanation and depth of knowledge have helped us gain a better understanding of this important topic. I would also like to express my sincere gratitude to our respected principal and the management for providing us with this valuable opportunity to organize and participate in such an informative online sessions. Once again, I thank Dr. Jenny and also our viewers for joining us today. Please stay tuned for our upcoming health talks where we will continue to bring you more informative and engaging sessions. Thank you.